is for Nigerians, and therefore Nigerians deserve to know. You also see that distinguished gentlemen of the press, that is also an opportunity for you most of the time when you keep chasing some of these ministers and heads of parastatals to get them to talk to you about policies of government. The ministry also feels that this is a good opportunity for these ministers to come under this platform so that you get to know what they do, and then you also have opportunity to ask them questions. Like I said, today is the third in the series, and we have the distinguished honor of the presence of Professor Mohammed Ali Pate. He is actually the Honorable Minister of Health and Coordinating Minister of Health, actually, and Social Welfare. He is not new to you. All of you know him. Today, he's going to talk to you about the activities of the ministry, and he also has directors and heads of parastatals under his ministry for you to also ask questions if you do know.
We don't leave Nigerians behind in this aspiration to have good health and well-being. We articulated a 4-point agenda and 3 cross-cutting pillars. So the report that I will share with you is what has transpired since then in very tangible terms, and we can discuss them. On the first pillar of governance, to improve the governance of the health sector consistent with the National Health Act, we operationalize the national health system with the federal government and states signing a compact in December for the first time that governs the interrelationship between federal government and states to improve the health and well-being of Nigerians, along with the external development partners who are contributing, complementing what government is doing, but aligning with the priorities of government. And in that meeting in December, you all were witnesses when they announced $3 billion complementary to the federal government's effort for the next 3 years to be spent in improving the health outcomes of Nigerians, using primary health care as the basis for that. Of that announcement, we've already signed almost $1 billion in terms of grant, have approval for $200 million complementary grant, and the rest of the $3 billion is in line. We are proceeding with discussions to operationalize them in the context of the sector-wide approach to improve primary health care using PHCPF as a vehicle, and I will touch on it later again. We try to improve the positioning of the regulatory bodies in health. NAFDAC, to strengthen it from maturity level 3 to begin to move towards maturity level 4, so that we make safety of drugs, food that is mandated on us by law to be executed appropriately by NAFDAC, as well as other regulatory bodies, whether it's the Pharmaceutical Council or Medical and Dental Council of Nigeria or the Global Service Commission, to ensure that the governance function, the stewardship role that we have, is executed as much as we can, and then to do so while responding to the needs of our citizens. So through consultation with civil society organizations, we had several fora with civil society to engage, in addition to the survey, the People's Voices survey that asked Nigerians what is their need and how do we respond better. That citizens orientation, you will agree with me, is one of the key pillars that the President has directed us to do, to respond to what Nigerians are actually yearning for. And we intend to continue in that direction. Now, the second pillar on improving population health outcomes, we are laser focused to improve the primary healthcare system with the interventions, preventive and curative interventions that will improve health outcomes, as well as our hospitals. We're expanding the primary healthcare centers that are benefiting from the Basic Healthcare Provision Fund from 8,000 that existed until now, some of which are not entirely fully functional, to make them functional and expand them to 17,000 by the end of 2027. And the primary healthcare centers, with the support of the federal government, complemented by the states, are delivering antenatal care, skilled birth attendance, immunization. And you will all recall, last fall, we had an outbreak of diphtheria in Nigeria. It was in 14 states. By August, September, it had been going on for 9 months. Now, the diphtheria outbreak has receded. What have we done? We immunized 5 million children with the pentavalent vaccine as part of the diphtheria response, and 10 million children between the age of 5 and 10 with TD vaccines, so 15 million doses of vaccines. And that has curtailed the diphtheria outbreak, not as much as it was in August and September. In October, we launched the first phase of the HPV vaccination in 15 states. In the 15 states where this vaccine was launched to prevent cervical cancer, at least 4.95 million eligible children were immunized. That's 80%. That is an impressive performance by Nigeria for the first phase states. The second phase states will start their vaccination in May this year, and preparation is already underway, learning lessons from what had transpired in the first phase. And with regards to the Basic Healthcare Provision Fund, we've strengthened the fiduciary system so that the resources that will channel to the primary healthcare centers will indeed reach the primary healthcare centers and serve Nigerians. And we've had discussions with the Governors Forum, with the National Economic Council, and with the President's direction. We are tightening up the fiduciary system so that when we disburse 50 billion by the end of this first quarter of 2024 to the primary healthcare centers through the MPHCDA gateway or the NHIA gateway, the resources will indeed reach Nigerians and will be subject to social accountability measures so that we see the impact of those resources that are coming from the federal government's portion of the federation account. That's the 1% CRF. In addition, over the last several months, 2,497 doctors, nurses, and midwives have been recruited in our primary healthcare centers to fill gaps and to help in delivering services. And hundreds of thousands of Nigerians have been enrolled in the health insurance program through the National Health Insurance Scheme and the Vulnerable Groups Fund. We increased the quota for the schools of training of nurses and midwives. We doubled it. And we're working towards increasing that for other health cadres as well, so that we can increase the production of health workforce that we need. We know that in many parts of our country, we're struggling with that. In addition, we spent time to build an approach to invest and renew the health infrastructure in our hospitals. Recently, as you are aware, the President approved, in fact, the infrastructural upgrades and equipping of 6 cancer centers in the 6 geopolitical zones in collaboration with the NSIA. That is in the 2024 appropriation of the federal government. In addition, there are 8 diagnostic centers and 2 oncology centers that the groundbreaking ceremony will be conducted very soon as part of the renewal of the health infrastructure in federal tertiary hospitals.
And gentlemen of the press, let me close by saying that this country belongs to all of us. What we are doing today, as we always do, is to ensure that the media, Nigerians, those who are also at the position of leadership are brought together for a conversation around how this country will develop. I think it is important that we need to emphasize the positives out of this country. I've learned so much from what has happened today, and I'm sure that my colleagues here have also taken copious notes about some of the achievements we are getting in this sector. We'll continue to do that, deepen this conversation across sectors so that Nigerians will be better informed. Hopefully, and I mean hopefully, my colleagues, let us report what is good happening in this country so that we de-emphasize the negative. Nigeria is a great country. We have so much to give. We have, of course, some challenges, but I think that it is something that we can all talk about instead of condemning our country and thinking that we can go elsewhere. We have no any other place to go. This is our country. We must remain here. We must all salvage it together.